The culture of research teams tends to reflect embedded biases about leadership, representation, and inclusion. It takes an intentional choice to pivot toward more equitable teams where power and decision making are shared, more diverse perspectives are represented, and all team members feel seen and heard. That's why a national nonprofit has released a new roadmap for researchers to help advance equitable research. The roadmap suggests ways to promote equity in 10 steps across the research lifecycle, and it's already making a difference in health systems, nonprofits, trade associations, and academic research teams. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly with AHA Communications. Academy Health is a DC-based nonprofit that has created a sort of how-to guide designed to provide cohesion and a sense of shared mission for health equity researchers and advocates. As we learn in this podcast, hosted by Joy Lewis, Executive Director of the AHA's Institute for Diversity and Health Equity, the roadmap's influence is already being felt across a variety of workplaces. Joy's guest is Margo Edmunds, Director of the Academy Center on Diversity, Inclusion, and Minority Engagement. And now, to Joy.
I am excited to discuss this new resource that Academy Health released earlier this year in April for the health services research community, and it's called the Roadmap for Researchers. And the goal here is that it provides actionable, evidence-based guidance on advancing racial equity perspectives in health systems and policy research. And if I'm remembering correctly, the roadmap is not intended to be didactic, but rather to be used as a tool as researchers are really planning and designing their studies. And it builds in some accountability around ensuring that these perspectives, the racial equity lens, is applied to the research. So, with that being said, I do want to invite you. I'm super familiar with Academy Health from over the years, but I wondered if you wanted to start by sharing just briefly for our listeners what Academy Health is for those who might be less familiar with your organization.
Absolutely happy to start there. And it's great to see you, Joy. And I really appreciate the invitation to talk about the roadmap. Academy Health is a DC based national nonprofit organization with individual and organizational members from both public and private sectors, and a portfolio of grants and contracts that translate health systems research into policy and practice in healthcare and health. So, a very broad mission of translating research findings so that they can be useful and actionable.
Right. I like to talk about that as the real world implications or the real world application, rather,
Yes.
of the research so that the research isn't sitting on a shelf somewhere, but it's being put into action. So, talk a little bit more about the background, the vision for the roadmap. What was happening at Academy Health? What led to the development of this tool?
Well, it's a great question. It actually took about 10 years to evolve.
Wow.
You probably know the history that the Academy Health Board of Directors in 2014 decided that it was important for Academy Health to start diversifying the workforce and providing scholarships and stipends for emerging researchers who might not have their own grant portfolio yet, and who wanted to be researchers and who were promising. And so there were the Aetna Foundation, when Dr. Ann Beal was president of the Aetna Foundation, they gave a grant for Academy Health to do a competitive process and identify some of these emerging folks who are actually still very active in Academy Health. People like Rachel Hardiman and Jamita Barlow and Reggie Tucker Seeley started with us 10 years ago and began to diversify the workforce with folks like this, and then began to bring them together once a year for a networking reception. And over the years, we've now grown to about 400 people and their mentors who come to a party reception. It's turned into more of a party as it's gone along.
Who's going to say no to an Academy Health party, right?
Oh my goodness. We just had our most recent one was in Baltimore, and it just rocked. So it's a very nice opportunity for people to meet each other in a not always quiet, but in a safer space, where everybody is there because they believe in mentoring and believe in what we're trying to do. So that has been going on for 10 years. But we also realized that Academy Health wanted to provide a different kind of leadership and take our work to another level. And that happened particularly in 2020. We were working with the Robert Wood Johnson Foundation on an advisory group report about what we could do to help the field become more diverse and more culturally competent and more engaged with communities, really change our culture. So we released a report in 2021, and among the recommendations were y'all need to get out there and help people be better at the way that they interact with communities and be more authentic and really learn what a lot of these communities and individuals have been dealing with for a long time and not turn away and not just keep documenting disparities. Particularly right now when we're having this pushback, I think it's really challenging us to articulate who we want to be and how we want to be with each other. So that's where this roadmap came. I was getting a lot of calls from people, and I felt I can't keep answering individual calls as efficiently as I might be able to write something. So I'm a former professor, so I wrote a 10-step process. And the first step is get your team in a room and look around and see if you have the right people in the room. It's very practical advice, just has a list of questions for people to consider. We don't tell them what to do. We just say, here's how to think about it.
But you were able to get to your point, your leadership, your thought leadership, your point of view out there in the world for others to really consider how they might adopt and utilize the resources you're putting in front of them. So, could you go one step further in providing an example of how an organization or a researcher would, in fact, utilize this resource?
Well, we're finding out about that, Joy, because more and more folks are beginning to use it thanks to you and to the collaborative. I think we have more people joining all the time, but Indiana University, for example, St. Louis University, and Medical University of South Carolina are all using it as core curriculum in their policy classes. So this is how to do the right kind of research. This is how to do racial equity research. NCQA, Rachel Harrington was one of the reviewers, and so she has been very helpful in using it at NCQA with her teams and the equity teams, and the other folks who may be new to the area and less comfortable, afraid they're going to make a mistake. Altarum Institute, which is a contract research organization in Northern Virginia, Altarum has a page on their website, and they are also using it with their staff and with teams of folks. So I think it could be used across settings. We're not sure how it's being used in clinical settings yet, but we think, we tried to chunk the material into 15-minute segments, knowing that that's about how long somebody might have at a break, and they could read a couple pages and think about some questions. So it's meant to be versatile, practical, and kind of in the eyes of the beholder, if you know what I mean.
Right, right, right. And I'm glad to hear you're moving further upstream to academia and in the classroom environment. With that, you mentioned the Health Equity Strategic Learning Collaborative that we stood up here at the association, which is exactly, the audience you would be targeting for this kind of a resource. These are health services researchers who are focused on health equity specifically. And we have a particular focus on even going one step further and really trying to find those researchers of color who are proximate to many of the research opportunities in the health equity space and who really would benefit from having this network where, frankly, historically, much of their research might not have as much visibility or as much of an opportunity to be really put into action and mainstream. So you've been active at that table. Really appreciate your partnership. And so I wondered if you would share with our listenership what are some of the benefits of being a part of the health equity strategic learning, collaborative.
Thank you for asking, Joy, because I've been wanting to thank you over and over again for inviting me to be part of the collaborative, because it meant a lot to me, not just for the networking and for the safe space to talk to other people, but it was an endorsement of the work. And I think a lot of us, we talk about this, how isolating it can be to do equity work. You don't feel, especially if you don't have a team of folks or you don't have the team that you want, or enough resources. And so I think that the time I've spent with the collaborative has been well spent. I feel like it's a time when I can see people I've known for years, like myself and don't get to see often enough, but it's also a place where there's a common understanding that it's important to continue this work even when it's challenging. In fact, the more challenging it gets, we have to take care of ourselves and not burn out, but we also need to continually renew our commitment, and that's a really great place to do it. And it also has been the very first place where I spoke publicly about the roadmap outside of Academy Health, and I've gotten great responses from the colleagues that you invited to be part of the network. So thank you for doing that.
No, great. We're looking forward to really learning also from the researchers in that network. How much more can the collaborative bring benefit to them? We certainly see it as bidirectional. So thanks for putting this resource in their hand. Are there any other initiatives or offerings or spin-offs that you see coming out of the research roadmap?
We've been doing some word of mouth dissemination and trying to kind of collect stories so that we know how people are finding this helpful and where they'd like us to push in another direction. But one thing that I initiated, I'm kind of a I like online tools and I like open access. So we have, again, with support from the Robert Wood Johnson Foundation, we have an equity and innovation resource hub which you can find at the Academy Health website. But these are meant to be companion documents. And a former professor I'm thinking about, you want something that's online with a lot of deep content. It's got 25 pages, I think, of resources, of peer-reviewed articles and playbooks and lots of other resources that people can use. The Equity and Innovation Resource Hub is searchable by media. So if you want a video to show in your class or at your staff meeting, you can go find a video that's related to kind of introducing the content. And we also have infographics and playbooks and peer-reviewed articles and gray literature and other resources that have been vetted and are curated by Academy Health. So I think a lot of people, when they start thinking, oh my goodness, I'm teaching a health equity course, where am I going to start? We want to have vetted and curated that material so that they know where to start.
No, that's awesome. Thanks for doing that heavy lifting up front for folks. So, with this particular resource, though, the roadmap for researchers, what is your hope, right, in terms of how this could potentially change the design of health services research, potentially lead to better health policy, even?
So my hope would be for 10 years from now that the field will have evolved to a much more inclusive and representative group of people who really value diversity.
Diversity of all kinds, diversity in its broadest definition.
I've talked with some of our folks who work on the Hill and work in different kinds of environments, and I think that health equity or equity are the terms that seem to be the most acceptable when you talk about multicultural and actually, multi in many ways, multi lived experience, people who are coming from first generation backgrounds into the research community, that they will feel that they have the kind of support and acknowledgement and then that they're valued. And I think if we can acknowledge that people's backgrounds and where they came from and what their parents did and what languages are spoke at home, but also what might have happened to them on the way to work. You might have gotten some side eyes from people. This is a very common experience that I think a lot of white people do not have and do not appreciate and don't acknowledge. So my hope would be that in 10 years, there's been enough personal transformation and insight and behavior change that everybody would feel welcome. 10 years is pretty fast, but I know people can change. I'm originally a clinical psychologist, as you know, and I know that people can change, and I know that cultures can change, and sometimes in a very short period of time.
Well, you've leaned into hope in its strongest definition. Hope, all caps, because that's hope that you're leaving with us, Margot. I trust your hope becomes a reality because I think we could all, lift all boats as we go here, right?
Well, we need each other to do that, Joy, and that's why I'm, again, really pleased and honored and grateful that you created the network because it's important, I think, for all of us to use the platforms that we have and to use our voice in the most effective way possible. And I've seen people in the network talking about things that I have not heard about before. The work that they're doing in their own institutions and how thoroughly it can be done when you have the support system to do it. It's amazing.
Well, thank you. And thanks for spending some time with me this afternoon as we really lean into helping our health services researchers writ large really navigate the roadmap and think about its application to their upcoming body of work. So thank you so much, Margo.
Thank you for the opportunity, Joy. Great to see you.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.